Public health specialist Dr. Janet Ekpeyong joins us from our Abuja studio right about now to talk about the possible cholera outbreak at holding camps for IDPs and, of course, flood victims. Great to have you on the program News Across Nigeria. All right.
Thank you very much for having me. Good afternoon.
Yes, good afternoon indeed. Now, experts say the relationship between cholera and climate change is the change in rainfall patterns, which has already led to an increase in rainfall and a huge amount of flood, which carry dirt and deposits into water bodies used by the people for drinking and cooking. Now, we know that many communities in Nigeria are currently affected by the floods. Is there any possibility of cholera outbreak, even as we speak?
Thank you very much. Absolutely. My heart really goes out to all the states and communities that have been affected. I mean, these are some of the things that we can not really control. And yes, one of the diseases they're actually really prone to right now is cholera. And we need to really spring into action. I mean, we just need to act very fast because we know that access to clean water is totally related to, of course, issues around cholera. So right now that the communities are facing flood, we need to be concerned about, quality, access to quality water right now, because I don't think we really want to see situations where such communities will have to start facing outbreaks of cholera and other waterborne or diarrhea diseases, which of course we know can be, bringing a lot of issues that could even lead to mortality. So yes, it's a huge concern, and we need to act very fast and ensure that these people have access to clean water, even in the face of such environmental factors.
Which brings us to the next question. Of course, you already know that state governments have established quite a lot of holding camps, and some are staying in IDP camps, internally displaced persons camps, as it were. We know that cholera outbreaks can occur where water supply, sanitation, and food safety, and even hygiene are, all inadequate. These are some of the challenges that the flood victims will be facing. So what should be done to avoid an outbreak?
Okay, so I want to believe that some of the camps where these people are being kept, I want to just believe that at least they would have had boreholes there, and of course access to other water, because like you rightly stated, cholera is directly related to, of course, hygiene and environmental hygiene, as well as food and water. So right now they need water, and if such communities do not have a borehole, then of course other alternatives need to be made immediately, while of course making plans for portable boreholes and the rest of them. Then, of course, right now, food is very important as well, because in as much as we're trying to prevent cholera, we must ensure that the children are not malnourished, because they need to have access to good food. And of course, the people preparing these meals, we need to ensure that they all observe good personal and, of course, environmental hygiene. Hand hygiene is key right now, because we know that cholera has a lot to do with, of course, fecal-oral route transmission. And so we must ensure that at this moment, they should also have access to, sanitation facilities where at least we know that environmentally they're not defecating around the premises or where they are residents right now, because that would definitely predispose them to cholera. So we just need to act very fast, and a lot of education is really needed. They need to be sensitized on the risk of possibly having an outbreak in such a camp, so that at least they'll be able to make the right decision, ensure that they get clean water to drink, ensure that their food or their meals are properly prepared, ensure that they use, the sanitation facilities or the wash facilities that are provided, judiciously, and avoid open defecation at this moment, especially when we know that most of their everywhere is flooded, and of course such waters could still end up to where they are getting their drinking water from. So right now, every hand needs to be on deck, and proper education is really needed at this moment.
All right, so doctor, very quickly, of course, we know the cholera patients develop severe watery diarrhea with vomiting. Now, what would you suggest? Should NEMA and of course, the state emergency management agencies run a 24-hour clinic to help us, support the victims from cholera spreading? And of course, a second one, polio. We talk about polio as well, which is no longer endemic in Nigeria. But is there any possibility that may, resurge, or there may be a resurgence in polio as well, even as we speak?
Okay, so for the intervention these people need, of course, in as much as NEMA is doing the best to provide food and other, toiletries and other things that they require. Healthcare is very important right now, and I must call on all the Ministry of Health, the primary healthcare agencies in such places to begin to act very fast. We must set up, health posts immediately at such facilities and ensure that the children there, check their immunization status, ensure that they are covered, and also try as much as possible to provide other health services for those that will require such services. And because of possibility of coming down with cholera, it's also encouraged that they should have the oral rehydration solution readily available. And of course, there should be around the clock, health services provided in such camps. That we're hoping that we just need to act very proactively, just to ensure that they can put everything under control. And I believe that will also help to ensure that we do not have come down with issues of cholera outbreak. Surveillance is really key at this moment. While, of course, they're providing all the health personnel and other services there, they must also intensify surveillance in such areas just to make sure that they are not overwhelmed, or if such cases to come up, they can quickly be nipped at the bud and avoid the spread, of course, to other children. Then, of course, we know that polio also is, of course, could be waterborne, being that could come from one person to the other. And of course, water can play a huge role in the transmission of polio, in the sense that an infected person, if the person should defecate in the open, and of course, rain and a flood takes out this feces, of course, we know that the infective organism could be transmitted from that through water, of course, to another individual, and they could be prone to polio diseases. So definitely, it's a huge concern for us, and we hope that at least this will also be tackled and ensure that every child within the ages of 0 to 5 years are fully covered and immunized in such camps, so that they will not fall victim of any case of cholera or polio or any other vaccine preventable diseases at this moment. But yes, it calls for concern. That's a possibility that, of course, we could have cases of polio. But I'm certain that if we act proactively in ensuring that those children are covered, and of course everyone tries to maintain good personal and environmental hygiene in such cases, then we should be able to prevent that.
All right, Dr. Janet Ekpeyong, we thank you so much for your thoughts, a public health specialist. We thank you once again for your thoughts here on News Across Nigeria.
Thank you so much for having me.